The glucose tolerance test, GTT, is a routine screening test conducted during pregnancy to check for gestational diabetes. Gestational diabetes is a condition in which the body cannot produce enough insulin during pregnancy, leading to high blood sugar levels, which can affect both the mother and baby. When is the glucose tolerance test done? The test is typically done between 24 and 28 weeks of pregnancy during the second trimester. This timing is important because gestational diabetes often develops in this period. How the test works. 1. Initial step, the glucose drink. You'll be asked to drink a high glucose solution that contains a specific amount of sugar, usually 50 grams. The drink is sweet and some women find it difficult to drink because of its strong sugary taste. 2. Wait for an hour. After drinking the glucose solution, you wait for 1 hour in the clinic or a medical office. 3. Blood sample. After the hour has passed, a blood sample is drawn to measure the level of glucose in your blood. Results interpretation. Normal range. If your blood glucose level is below a certain threshold, usually around 140 mg DL or 7.8 mol LL, the test is considered normal. High blood sugar. If your blood glucose is higher than the normal threshold, it indicates that you may have gestational diabetes and will need a follow-up test, which is the oral glucose tolerance test, OGTT. Follow-up test, oral glucose tolerance test, OGTT. If your initial test result is elevated, you may be asked to undergo the OGT, which is a more comprehensive test. For the OGTT, you'll be asked to drink a larger amount of glucose, 100 grams, and then your blood will be tested at different intervals, usually at 1, 2, and 3 hours. If 2 or more of your blood sugar readings are higher than the normal range, you may be diagnosed with gestational diabetes. Why is the test important? For the mother, gestational diabetes can lead to complications like high blood pressure, preeclampsia, an increased risk of needing a C-section, and a higher chance of developing type 2 diabetes later in life. For the baby, if untreated, gestational diabetes can lead to excessive growth of the baby, which increases the risk of delivery complications, such as shoulder dystocia. Babies born to mothers with gestational diabetes are also at risk of low blood sugar after birth. What happens if you're diagnosed with gestational diabetes? If you are diagnosed with gestational diabetes, it's important to manage your blood sugar through diet, exercise, and sometimes insulin therapy. The condition often resolves after childbirth, but it's important to monitor your blood sugar levels and maintain a healthy lifestyle even after pregnancy. The glucose tolerance test helps identify potential issues early, so proper care can be taken to ensure the health and safety of both you and your baby.